Okay, so we're talking about the 4 reasons you would mechanically ventilate a patient. And you have to remember that to begin, you have the 4 reasons you would intubate a patient, which is they cannot ventilate on their own, they have an obstruction of their airway, they cannot protect their own airway, or they have excessive secretions and they need suctioning. So with that, these kind of go hand in hand, but they're different. You have apneic. The patient has experienced trauma, especially in the thoracic area. The patient is impending ventilatory failure, or they have ventilatory failure. And so what that means with those 4 is when they're apneic, the patient is no longer breathing on their own, especially. And those can be caused from CNS depression, which is the central nervous system becomes depressed. Examples of that is drug overdose or alcohol overdose. You could have trauma, which would be anything from gunshot wound to stabbing, especially in the thoracic cavity. You could have a car accident that caused flailed chest, which is where like the ribs break. Another example then for impending ventilatory failure is basically it means that the patient is leading towards ventilatory failure, and some of those signs that you would notice is their ABG goes towards respiratory acidosis, meaning that their pH is down, their CO2 would be increased, usually over 50. The pH would be under 7.3, and they would be hypoxemic. You would also probably see the patient being tachycardic. And then for ventilatory failure, that means that they are in the ventilatory failure. There's a couple reasons that could be causing this. And they would also have the respiratory acidosis, ABG, but it would obviously be accelerated from the impending. Some of the causes of this would be that the ventilatory muscles are extremely fatigued. You could have a neuromuscular disease like Guillain-Barré. You could have basically pulmonary complications, severe hypoxemia, and cardiopulmonary stress, which some of those would include prolonged shock. You could have a head injury. You could have too much major smoke inhalation, such as like a house fire. You would be hypoxemic severely and have hypoxia, especially of the brain and muscles of the heart. And then if you had any especially major surgeries in the thoracic and abdominal cavities, those would all be reasons that you would want to mechanically ventilate a patient. Also, with this being said, you always want to remember to just assess your patient and see how they're going when determining, and see that there aren't any options that are less severe for your patient to achieve what is wrong with them.